Hi, everyone. My name is Jillian Parker, and for a while now, people have been waiting to see if the COVID-19 vaccine would be approved for the age group of 5 to 11-year-olds. Well, the FDA and CDC have officially approved the Pfizer vaccine for emergency use authorization for that age group, the 5 to 11-year-olds. And today we're talking with some of our experts to answer some of the common questions you might have about the vaccine in kids, some of the differences and similarities maybe for the 5 to 11-year-olds versus the 12 and up. And joining us to talk about it, we have Dr. Stephen Schulz, the RRH and PCASI Pediatric Medical Director for Monroe County and FLMA, and Dr. Michael Pichichero, who is the Director of the RGH Research Institute. Guys, thank you both so much for joining us here to talk about this today.
Our pleasure.
Thank you. It's a pleasure.
I know a lot of people have questions, so for anyone watching this live, feel free to leave your questions in the comment section. We'll circle back around at the end of this interview to get to some of those questions that you might have, but let's just jump right in, gentlemen. First and foremost, I mean, there are going to be a lot of people who are both anxious to get their kids the vaccine. Maybe some people who are hesitant. So do you recommend that kids 5 to 11 get the COVID-19 vaccine?
100% yes. It's effective. It's safe. My own 9-year-old son, we already have his appointment booked. So we can't wait to get him taken care of.
I agree with Dr. Schulz, but we also need to recognize that both the FDA and the CDC committee acknowledge that this is a choice, and they acknowledge that they're clearly that the benefits outweigh the risks, and thus the unanimous votes in both committees. But they also realize that we should educate the public and anticipate that with good knowledge about the vaccine's benefits against the risks, that most, if not all, parents will choose to take advantage of this opportunity and protect their children from what can be a very serious and even fatal disease in 5 to 11-year-old children.
Having said that, was there any information specifically that came out of either the CDC's meeting or the FDA's meeting that you think is important to note for the public who may not be as aware of, what led to those unanimous decisions?
Yeah, I do think when we talk about just illness, the most recent data came out from the CDC that in the 5 to 11 age group across the country, there have been 172 deaths from COVID and 8,300 hospitalizations. So while many children have mild symptoms or even no symptoms, there are some children that get severely ill and even die from it. And there's no way to know whether that's going to be your kid or not, ahead of time. And that's where the vaccine and its effectiveness is really important. The other thing that we've really learned about is how important it is for kids to stay in school. We saw the negative impacts that last year doing the remote learning, even the hybrid learning had on all sorts of things. Reduction in education and learning, increase in mental health concerns, food security issues, obesity spiked. All of those factors can be alleviated and addressed through being in school. And so, that's why it's all the more important to be getting these vaccines into to all the children that are of school age to keep the schools safe, keep schools open, and protect against any new, variants or things that might change down the road.
I totally agree with Dr. Schulz said. I was struck by the discussions at both the FDA and the CDC, not only about the risk of disease, but also the risk of children missing school, and highlighting all the points that Dr. Schulz just made. I think that's very, very important. Another aspect that we might mention is if we vaccinate 28 million more individuals in the United States, it gives less of an opportunity for mutants to emerge and flourish, so that the overall campaign to get rid of COVID as a significant public health problem does require more and more individuals to be vaccinated to avoid that pool of susceptibles where the virus can mutate, and then we start right back down to where we were. You still hear those warnings from FDA and CDC because they're still very real.
Mhm.
And to
Go
piggyback
ahead.
off of that, I would just say we also have holiday season coming up. So not only are we protecting our children by having them get the vaccine, we're also protecting their classmates, we're protecting their teachers, we're protecting their coaches, we're protecting their families and our communities as a whole. And so with the holiday season coming up, there's going to be a lot more intimate gatherings, mixing between folks that have been vaccinated, haven't been vaccinated.
Yeah.
And this is going to be really important in keeping our children and families and communities safe throughout that time.
So the next thing people might want to know is when can I get my child 5 to 11-year-old vaccinated? How soon could we be starting to see those doses being administered?
So there's already been some distribution actively going on since the decision. It varies a little bit depending on your clinic and the timing on how quickly that's going to roll out. Some places, including pharmacies, are starting with rollouts this coming weekend already. Health departments, primary care offices are getting geared up, and some are going to be able to start right away. Some, due to distribution of the clinic and training of the staff and staffing availability, might be a little bit further out, but likely over the next week to two, we'll see the vaccine available widespread throughout the community.
And what should patients expect? How will they know kind of when that time has come for them to schedule their appointment?
I think a lot of places are going to be advertising. Typically, the county health clinics put out flyers that are distributed throughout the community, throughout social media, on when they're going to have them. Some school districts are partnering with the health departments as well to offer clinics at the school. Pharmacies are likely advertising as well, but you could go to any of the major pharmacies and look it up and find that pretty easily. Primary care offices, I think most of them are going to be reaching out to you to let you know when we're all ready. And right now, if we don't have it in the clinics and staff trained, having that extra deluge of calls isn't going to help. Trust that we're going to reach out to you through a variety of ways. Through, I know at Rochester Regional, we'll have it on our website. We'll be sending out My Care messages. We'll be reaching out in those ways to get folks aware of what's coming up.
Okay. And go ahead.
I wanted to add that I would recommend that for children 5 to 11, parents should make every effort to receive their vaccine from their primary care physician, their pediatrician, or their family doctor. I view this as a bit different than an adult vaccination administered in a big clinic or in a pharmacy, especially for parents who are not sure or even aren't sure they want to do it or they're hesitant. They should speak with their trusted primary care physician, their pediatrician, their family doctor to get their questions answered about their child specifically.
Yeah, and I would agree with that. At the same time, we don't want to prevent anybody from getting it. So, if you're in the boat that you want to get your child vaccinated, it's the right choice, we certainly would encourage you to get it by whatever means, wherever you can. There are those kids, and the advantage of getting in the primary care offices, we've given shots for years and years and decades in the pediatric offices, right? And we know how to work with the kids and alleviate their fears and administer it safely. So for those that have any concerns or questions in that regards, definitely we would encourage you to talk with us as primary care physicians.
And some common questions that I think some parents have, will the dosage of the vaccine for this age group 5 to 11 be the same as 12 and older, or will it be different?
It is different. The Pfizer dose is 1/3 of the adult dose. And that was based upon the average weight of an adult versus the average weight of a 5 to 11-year-old. Definitely the dose is different. and Moderna will likely follow, and they also are at the late stages of studying their vaccine in children, and they also significantly reduce the dose adjusted by weight of the age groups involved.
They will still get 2 doses. Am I correct?
Yes, it's still recommended 2 doses. We've learned a lot about the benefits of 2 doses, especially when we saw the J&J vaccine, which is it's a DNA-based vaccine, whereas Pfizer and Moderna are messenger RNA. But regardless, 1 dose is not as effective as 2 doses. And we see now the recommendation in adults for mix and match means you can switch among the vaccines, and we see that the messenger RNA vaccines, the Moderna and the Pfizer, boost better than the J&J a second dose.
And this might be very premature, but now we're seeing obviously booster shots being rolled out for adults. Is that something that eventually you could see for kids too, or is that too premature at this point?
It's being studied. So we wanted to get the vaccines launched, and now those children who participated in these trials will be monitored. Blood tests will be taken to look for how their immunity is sustained and whether they become susceptible to an infection. Thereafter, a decision will be made and recommendations will be made. It's too early to know yes or no. Generally, children respond better to vaccines with higher immunity. So I wouldn't say that the need for boosters in adults definitely means there will be a need for boosters in children. A driving force will likely be the emergence of variants. We've had the Alpha, we've had the Delta, we've had the Mu variant. There are other variants lurking, and if they increase in frequency, sometimes a solution is to give a booster.
Can you talk about why it took longer for the Pfizer vaccine to be approved for this age group rather than for everyone else who had previously been approved?
Yes, there are 2 main reasons. There are far fewer centers around the United States that are set up to do trials in young children, way fewer. And then in terms of the pool of parents who volunteer, it's a lower number. Fewer parents are able to get to those centers, and the perceived benefit of vaccination was clearly lower than the perceived benefit in adults. So there were fewer volunteers at fewer centers. That really was the holdup.
Can you share some information on, what data we have when it comes to side effects for kids in this age group at this point?
Yes. We know that the immunity system of a 5 to 11-year-old is pretty much the same as an 11 to 16-year-old or even an adult. The immunity system is pretty well set. So we saw exactly what we expected. The side effect profile of the shot was the same as older kid and adults in terms of, arms being sore, some fevers, some headaches, some fatigue. That was pretty much the same. There's been some discussion about the rare side effect of myocarditis, inflammation of the heart, that was observed transiently, and it went away on its own. It was observed in some adolescents, and in particular in young adults 20 to 30, and in particular in males. None of that reaction was seen in the 5 to 11-year-old test. However, you had fewer than 5,000 children in the test, and the frequency of myocarditis, heart inflammation, in the older age group is 1 in 125,000. So you might not see it if you only tested in 5,000. For parents who are worried about myocarditis, I would only point out that the chance of a child getting myocarditis in the older age groups, 1 in 125,000, is about the same as being struck by lightning. So it's a pretty low risk. Actually, if you get in your car and drive, the chance of having a fatal car accident is 1 in 100, but we still drive.
No, I think it's important to put kind of those numbers into perspective. And I mean, earlier on in the pandemic, there wasn't as much, we weren't seeing the numbers as far as kids getting COVID. Those numbers weren't as high as they were for other age groups in the beginning. But can you talk about what you've seen in recent months when it comes to younger kids? And do you feel like school also may have played a part in that as well?
So I think what we've really seen is the proportion of kids that are getting it increase. And so the biggest risk factor for that has been the fact that adults have been able to be vaccinated and kids have not. And so until now, and that's the excitement about what's happening right now. So while, children make up a certain portion of our population, the proportion of kids that were having positive COVID compared to the whole population was higher than the number of actual kids. And so, schools are doing everything they can to be safe. I know in New York, we have very strict regulations and guidelines around masking and physical distancing and testing and all that multi-layered strategy that helps to keep kids safe. So luckily, we haven't really seen transmission within our schools here. Around the rest of the country, there's a lot of places that are doing the exact opposite, and government regulations are saying you're not allowed to mask in school or mandate it. And, those were the places that we really saw the numbers take off, especially in light of Delta, which we know is more infectious than Alpha was, and probably plays at least a part in why those numbers went up, the places that had the less stringent guidelines. Again, I think here locally in New York, our schools are doing a fantastic job of keeping kids safe. And, we've had the Reopening Schools Safely Task Force where the medical community is talking with the health department community who's talking with the school community. And we're on the same page as we're addressing this, and that's keeping kids safe. This is that one extra and probably even most important layer that you can do for your child to keep them, their classmates, their teachers, their coaches safe.
And Dr. Schulz, what are you seeing in your office right now in terms of kids needing to get a COVID test because of possible exposures?
We're still slammed. We're getting calls left and right. Unfortunately, we can't accommodate everybody who needs to be seen, who needs to be tested. And, we've been tweaking our triage guidelines to allow for more testing and more access as possible, but the demand has just been overwhelming. And so this is another really important thing where we're going to see that demand drop the more kids that we're able to get vaccinated. We're going to be able to see some of these rules and regulations that are in place start to be relaxed a little bit as we see our numbers in the community coming down.
And there are some people who know for certain that they will be getting their kid vaccinated as soon as they can. But for people who aren't sure, who are still weighing risk benefit, looking through their information, what advice do you have for those parents who are making that decision whether or not they should get their child the vaccine?
I think if you're on the fence, it's really important to talk to your primary care provider and get their input and, help understand where the concerns are and allow us to address those concerns.
I would add to Dr. Schulz's comment that in this era of social media, there's so much misinformation on the internet, and it's very difficult to sort that out. Often misinformation has a thread of truth mixed in that kind of gives it a sense of validity. So we need to be very cautious about that. And when we look for health information, to be aware of whether the source is reliable. I think you can be confident that information coming out of the CDC is reliable. The government has as their main focus the public health. So there would be no reason for them to offer misinformation surrounding the disease incidence, the benefits of the vaccine, the side effects of the vaccine. We're now, way into this, and I think the integrity of the process has displayed itself over time. Nobody's holding back anything that's known or proven. So go to a reliable source for information if to complement what you hear from your primary care provider.
We're going to wrap this up with just a couple more. Are there any groups of children within that age group that you recommend don't get the vaccine, that parents should be aware about? Any kids that have any pre-existing conditions or anything like that, where there would be a concern?
Actually, it's the opposite. If your child has a pre-existing condition, they should be first in line to get the vaccine. And we saw that as a very important aspect. And one of the biggest pre-existing conditions is obesity. So if your kid is overweight big time, that's a risk factor, but also asthma, lung infections, they should be first in line for the vaccine.
So that leads me into a question that someone left us on our Facebook page, which is someone asking, is it true or false that kids who get sick and hospitalized would typically have other health issues?
So the answer is, it's true that you have a greater risk of significant symptomatic COVID infection and hospitalization and ICU and dying if you have an underlying health condition. However, the majority of children who've had severe infection in the ICU, who've gotten the multi-inflammatory syndrome of childhood that is devastating or died, they were otherwise completely healthy children. So parents need to be cautious about taking a chance. I know we can sometimes make a chance for ourselves, but I can tell you as a practicing pediatrician, it's really tough to look back. If your kid had a very severe infection, ICU, died, and you could have prevented that by vaccination, the guilt is phenomenal to a parent in that case. And we're now hundreds of millions of doses down the street in terms of the safety of these vaccines. Those questions are largely answered. And we know that, hey, it's messenger RNA. That's in our body by the billions. And what's in there? Besides messenger RNA, a lipid capsule, that's fat. We're not allergic to that. And then there's a preservative. So the only contraindication is an allergic reaction to a prior shot, which can be due to polyethylene glycol, which is in shampoo, or polysorbate, which is in ice cream. I mean, it's just so rare to see a side effect. So virtually 100% of kids can be vaccinated.
Last one I want to ask you guys before I let you go. This was an argument that was being made in adults, and I assume the same argument will be made in kids, which is if someone has already had COVID-19, they think that they don't need the vaccine because of antibodies. What is your response to that?
It might be true that after infection, you end up with very strong immunity that's sustained. But the research has shown that quite a few individuals after infections don't develop a sufficiently strong immunity to prevent getting reinfected. And based on the scientific data, that's the reason you see the recommendation that even if you had COVID, you still should go and get the vaccination. That's scientific proof. The other thing that's likely going to happen is down the road, you'll need a card that says you've been vaccinated in order to enter, leave the country, get a passport, go in a restaurant. So having that card is going to be important. Until we have an immunity test, a blood test that can be used to predict that you are protected and you're sustained protected, that vaccine card is going to be your passport for freedom.
Is there anything else that either of you would like to add before I let you go?
Great questions. Thank you. And I think we addressed those in the chat line as well. It's been a pleasure.
Okay, awesome. Thank you both so much. And again, anyone with still any questions after this is over, please feel free to leave those in the comment section. We'll have our experts answer those at a later date, and we'll keep you updated as to when Rochester Regional Health will be administering those COVID vaccines for kids age 5 to 11, as that has finally been approved by the CDC and FDA. Gentlemen, thank you so much. Have a great day.
Thank you.
Thank you.